Hi, I'm Eric Goldstein. I'm a vascular neurologist with Rhode Island Hospital Comprehensive Stroke Center. Stroke is something that comes on very quickly. There's two different types of strokes. One's where there's not enough blood getting to the area, called ischemic, and one's where there's too much blood, so a hemorrhagic stroke. Both present very similarly in terms of typically having weakness, numbness, changes in how you're thinking, interacting, changes in how you're talking. There's an acronym called FAST, and some people actually call it BFAST. BFAST is B for balance, E for eyes or vision changes, F facial droop, A arm weakness, S is speech, and T is time. So if you have any of those symptoms, you need to call EMS or 911 as soon as possible to get to the emergency department. As you get older in life, your risk of stroke goes up. So certainly the elderly and people who are above age 65 have an increased risk. People who have different comorbidities such as heart disease or have diabetes, those individuals have an increased risk of stroke as well. To reduce the risk of stroke, you really have to work with your primary care doctor or your neurologist or even a cardiologist to find the risk factors that are contributing to your stroke risk. Typically, blood pressure, uncontrolled diabetes, bad cholesterol, smoking, uncontrolled sleep apnea, poor diet, and living a sedentary lifestyle are all contributors to increasing the risk of stroke. There was a criteria that was developed called the Snoop, SNOOP criteria, to help with patients and doctors to pursue next level testing. S is systemic features, so do you have fevers, do you have weight loss, do you have something else going on that can make the headache worrisome? N is neurologic history, so if you have weakness on one side of the body, numbness, changes in how you're talking, thinking, interacting. O is onset, so if it comes on very, very quickly, almost like a thunderclap, very quick, then we certainly need to go to the emergency department. If you're after the age of 50 and you're having new headaches, that's another worrisome feature. And then if you have a previous history of headaches, if there's been a change in those headache semiologies, then it's time to see a doctor and maybe get an MRI scan. Certainly, COVID-19 has caused a lot of issues in the community, especially with healthcare providers and access to care. As we are starting to understand more about the virus, we're able to cope with some of the challenges that it's posed. If you're pushing off medical care for concern of contracting COVID, now's a good time to try and reach out to your doctor's office and ask him what precautions are in place and to see if there's any virtual visits that they're offering at this time.